Welcome to Tips for Senior, the channel where we share useful knowledge to help seniors live healthier and happier every day. Dear friends, have you ever noticed that your memory seems to be getting worse lately? Maybe you're forgetting things more often or mixing up simple daily tasks. Thinking face. Don't worry just yet. Sometimes the cause isn't age or illness, but rather the very medications you're taking every day. Face with open mouth. Many common medications in the U.S., from sleeping pills and allergy meds to blood pressure drugs, can affect memory and brain function in older adults, especially when taken long-term or incorrectly. In today's video, we'll explore the 10 most common medications that may impair memory in seniors. This will help you recognize the risks early and talk to your doctor about safer alternatives. Backhand index pointing right. Make sure to watch until the end to find out which medications you should pay special attention to. 1. Benzodiazepines, sedatives that silently kill seniors' memory. Common medications: diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, clonazepam, Klonopin. Magnifying glass tilted left. What are benzodiazepines? Benzodiazepines, often referred to as benzos, are a class of sedative medications commonly prescribed to treat chronic anxiety, long-term insomnia, seizures, panic disorders, and sometimes used during alcohol withdrawal. They work by calming the central nervous system, helping users feel relaxed, fall asleep more easily, and reduce stress. Warning: why do these drugs affect memory in seniors? Older adults are much more sensitive to the side effects of benzodiazepines than younger people. That's because the liver and kidneys in seniors function less efficiently, causing the drug to remain in the body longer. The aging central nervous system becomes more vulnerable, making the brain overreact to sedative effects. As a result, the medication doesn't just calm anxiety, it can also slow down information processing, cause short-term memory loss, lead to confusion, especially in the morning, increase the risk of falls due to poor balance. Some studies in the U.S. have even found skull and crossbones seniors who use benzodiazepines long-term have a 50% higher risk of developing Alzheimer's disease than those who don't. Older adult. A concerning reality: benzos are still commonly used among seniors in the U.S. According to the CDC, Centers for Disease Control and Prevention, about 10 to 15% of adults aged 65 and older have been prescribed benzodiazepines. Many of them use these medications for months or even years. This is troubling because these drugs shouldn't be used for more than a few weeks, unless closely supervised by a specialist. White heavy checkmark: safer solutions for seniors. If you're taking medications like Valium, Xanax, or Ativan and notice increasing forgetfulness, confusion, or frequent falls, talk to your doctor. Don't stop the medication abruptly, but you can. Ask about gradually lowering the dosage. Explore safer alternatives, such as deep breathing exercises, light yoga or meditation, milder sedatives with fewer cognitive side effects, psychotherapy for long-term anxiety. Pushpin: important reminder for yourself and loved ones. Benzodiazepines are not a long-term solution for insomnia or anxiety in older adults. If you've been taking them for more than 2 to 4 weeks, it's time to reevaluate with your doctor. Memory loss isn't always caused by aging. Sometimes, it's the medication you're taking every day. 2. Non-benzodiazepine sleep medications help you sleep tonight, harm your memory tomorrow. Common medications: zolpidem, Ambien, disopicolone, Lunesta, Zaleplon, Sonata. Sleeping face: what are non-benzodiazepine sleep medications? These are commonly referred to as Z drugs because their names typically start with the letter Z. They are prescribed to treat insomnia, particularly trouble falling asleep or staying asleep, help people fall asleep more easily. Although chemically different from benzodiazepines, their mechanism is similar. They affect the central nervous system, causing mild sedation, calming the brain, and inducing sleep. Many seniors in the U.S. prefer these medications, thinking they are lighter than sedatives. However, the reality is, warning: worrying side effects for older adults. While they help with sleep, medications like Ambien and Lunesta can silently destroy memory, particularly in those over 65. Brain short-term memory loss. Users often can't remember what they did the previous evening. Some even report talking, eating, or driving while asleep, without realizing it. Cyclone confusion and disorientation in the morning, when the drug still affects the body upon waking up. This increases the risk of falls, especially at night when going to the bathroom. Worried face disruption of deep REM sleep, a vital stage of sleep for memory restoration and brain cell regeneration. Repeat button dependency with long-term use. This can make seniors more dependent on the medication, leading to a cycle of insomnia, taking the drug, memory loss, taking it again. Chart decreasing worrying statistics in the U.S. According to the FDA, U.S. Food and Drug Administration, millions of Ambien prescriptions are written each year, particularly for individuals aged 60 and above. However, the FDA has warned that loudspeaker seniors may need doses that are less than half of those prescribed for younger individuals, as the drug stays in their bloodstream longer and poses a greater risk. White heavy checkmark safer alternatives. If you're taking sleep medications like Ambien or Lunesta every night, keep the following in mind. Don't use them for longer than 2 to 4 weeks unless strictly monitored by your doctor. You can try alternative methods such as herbal teas, e.g., chamomile or lotus root tea, taking a warm bath or soaking your feet before bed, listening to relaxing sounds, such as rain or ocean waves, maintaining a fixed bedtime and avoiding screens, phone/TV, before sleep. Pushpin. Remember, good sleep is essential, but not at the cost of your memory and daytime alertness. If you feel forgetful, confused, or fatigued despite getting enough sleep, check to see if your sleep medication is silently causing harm. 3. Anticholinergic drugs, the silent enemy of seniors' memory. Common medications. Diphenhydramine, Benadryl, allergy medication. Hydroxyzine, Vistaril, Atrix, anti-anxiety, allergy. Oxybutynin, Ditropan, treats overactive bladder. Amitriptyline, old generation antidepressant. Scopolamine, motion sickness patches. Test tube. What are anticholinergic drugs? These are medications that block the action of a neurotransmitter called acetylcholine, which is crucial for memory function, concentration, learning, and information processing. These drugs serve various purposes, such as treating allergies, depression, overactive bladder, or motion sickness. The danger is that they are very common and often taken daily, yet many are unaware of their impact on the brain. Warning: why do anticholinergic drugs have such a strong impact on seniors' memory? When the level of acetylcholine in the brain decreases, the most noticeable effects are short-term memory loss, difficulty concentrating, confusion and disorientation, higher risk of dementia similar to Alzheimer's, especially with long-term use. As we age, the brain becomes more sensitive to the reduction of acetylcholine, making those over 65 years old far more susceptible to these effects compared to younger individuals. Bar chart research warning: long-term use of anticholinergic drugs equals increased risk of Alzheimer's. A study at the University of Washington, Seattle, tracked over 3,500 seniors for 7 years and found increasing seniors who used anticholinergic drugs daily for 3 years or more had a 54% higher risk of developing Alzheimer's compared to those who didn't use them. Even over-the-counter medications like Benadryl, often used for itching, insomnia, or colds, can contribute to cognitive decline if used long-term. Pushpin. Anonymous medications with high anticholinergic activity. Many seniors may be surprised to learn that the following drugs also belong to this group. Nighttime cold medications, containing diphenhydramine. Medications for frequent urination or bladder issues, like oxybutynin. Antispasmodic medications for stomach cramps, like dicyclamine, Bentil. Some old-generation antidepressants, like amitriptyline. Sometimes, doctors prescribe medications for mild symptoms without realizing the patient may be using other drugs with similar effects. When combined, the impact on memory can become severe. White heavy checkmark. What to do to protect memory while using these medications. Review all medications you are taking, including over-the-counter (OTC) drugs. If you find any anticholinergic medications, discuss alternatives with your doctor. Ask about switching to new generation allergy medications that don't affect the brain, like loratadine, fexofenadine. Bladder or depression treatments that are less harmful to memory. Brain important message. Dear seniors, acetylcholine is the friend of memory, and drugs that reduce this substance are the silent enemy of mental clarity. Be proactive in checking and protecting your brain today. 4. Tricyclic antidepressants, TCA, soothing the mood but clouding memory. Common medications. Amitriptyline, Elavil. Nortriptyline, Pemlor. Imipramine, Tofranil. Doxepin, Silenior, Sinequin. Pill. What are tricyclic antidepressants, TCA? Tricyclic antidepressants, TCAs, are among the earliest types of antidepressants, developed in the 1950s. These medications are prescribed to treat depression and anxiety, help with chronic insomnia, alleviate chronic pain and nerve pain, even help with irritable bowel syndrome or migraines. Due to their affordability and broad effectiveness, many doctors still prescribe TCAs to seniors. However, this comes with a significant risk to memory. Brain. Why do TCAs affect the brain in seniors? TCAs work by adjusting neurotransmitters in the brain, such as serotonin and norepinephrine. However, they also have a strong anticholinergic effect, reducing acetylcholine levels in the brain, similar to the effects of allergy medications like Benadryl. With long-term or high-dose use, TCAs can cause noticeable memory decline, especially short-term memory, confusion and disorientation, particularly upon waking, difficulty concentrating and remembering recent events, daytime drowsiness, which lowers quality of life. For older adults, these side effects are significantly more pronounced due to the natural decline of acetylcholine with age. Bar chart studies warning about the long-term effects of TCAs. A large study at Harvard University showed chart decreasing seniors over 65 using TCAs long-term have a 1.5 to 2 times higher risk of developing cognitive impairment compared to those not using them, especially if they have chronic conditions like hypertension or diabetes. In addition to memory loss, TCAs can also cause increased heart rate and arrhythmias, postural hypotension, dizziness upon standing leading to falls, constipation, dry mouth, and urinary retention. Older adult. Why are TCAs still prescribed to seniors? In the U.S., many older adults are prescribed TCAs because the medication is cheap and readily available, can treat multiple conditions at once. Some doctors may not be fully updated on the latest warnings. However, the American Geriatric Society has included TCAs on the BEERS criteria, which lists medications that should generally be avoided in people over 65 if possible. White heavy checkmark. Safer alternatives. If you're currently using medications like amitriptyline or doxepin, consider asking your doctor if you can switch to newer antidepressants, such as SSRIs, selective serotonin reuptake inhibitors, like sertraline or escitalopram, which have fewer effects on memory. SNRIs, serotonin norepinephrine reuptake inhibitors, like duloxetine, which also help with nerve pain. If you're using TCAs for sleep, ask about alternatives like sleep therapy, non-medication approaches, herbal teas and relaxation techniques before bed, low-dose melatonin for short-term use. Pushpin. In conclusion, antidepressants can help seniors feel better emotionally, but don't let that come at the cost of precious memory and mental clarity. Regularly review your medications and seek safer alternatives to protect your brain health. 5. Bladder antispasmodics, reducing nighttime urination but emptying the mind. Common medications: oxybutynin, ditropan, oxetrol, tolterodine, Detrol, solifenacin, Vesicare, darafenacin, Enablex, trospium, Sanctura. Pill. What are bladder antispasmodics and why do seniors use them? These medications are prescribed to treat overactive bladder, with symptoms such as urgency and uncontrollable urination, frequent nighttime urination, urinary incontinence, leaking before reaching the toilet. Many seniors over 60, especially women after menopause, are prescribed oxybutynin or toltrodine to manage these discomforts. However, there is a serious issue that many are not warned about: their negative impact on memory and mental clarity. Brain. Why do bladder antispasmodics affect memory? Most of these medications for overactive bladder have a strong anticholinergic effect, meaning they inhibit the action of acetylcholine, a neurotransmitter that is vital for memory formation and retention. The consequences for older adults: noticeable memory decline after just a few weeks of use. Difficulty concentrating, easily distracted. Some individuals start to get confused, repeat themselves, or forget simple words. Increased risk of falls due to balance issues or confusion. Among these drugs, oxybutynin, the most commonly used, has the most significant impact on memory. Bar chart. What do studies say? A large study published in JAMA Internal Medicine found chart increasing users of anticholinergic drugs for incontinence have a 50% higher risk of developing cognitive impairment after a few years of use. Specifically, oral oxybutynin, tablet form, has a stronger effect on memory than the transdermal form, such as oxetrol, as it more readily enters the central nervous system. Older adult. Why are these drugs still prescribed to seniors? Nighttime urination and urgency are common and affect quality of life. Some seniors are used to these medications and are reluctant to switch. Not all doctors are fully aware of the long-term effects on memory. However, many medical associations recommend avoiding these drugs in individuals over 65 if possible, especially for those showing early signs of cognitive decline, forgetfulness, confusion, or those at risk for Alzheimer's. White heavy checkmark. Safer alternatives. If you are using oxybutynin or similar medications, you should discuss with your doctor the possibility of switching to medications that have less impact on brain health, such as mirabegron, Myrbetriq, which works through a different mechanism and does not affect acetylcholine. Oxetrol transdermal patch, which has less impact on the brain compared to the tablet form. Additionally, lifestyle changes can help manage symptoms. Limit fluid intake after 7 p.m. Use the bathroom before bed. Perform Kegel exercises to strengthen the pelvic floor muscles. Avoid diuretic drinks like coffee and alcohol. Pushpin. In conclusion, don't let better bladder function come at the cost of memory loss. Managing an overactive bladder is important, but choose medications wisely to avoid sacrificing your mental clarity in the process. 6. Benzodiazepine sedatives, sweet sleep but a foggy mind. Common medications: diazepam, Valium; lorazepam, Ativan; alprazolam, Xanax; clonazepam, Klonopin; temazepam, Restoral. Brain effects on memory in older adults. Benzodiazepines help with sedation, anxiety, and insomnia by increasing GABA activity, a neurotransmitter that inhibits brain activity. However, in older adults, these drugs can cause temporary memory loss, especially for newly formed memories, increase the risk of confusion, misremembering, and forgetting recent events, double the risk of dementia if used long-term, cause daytime drowsiness, reducing alertness and reflexes. Bar chart. Medical recommendations. In 2015, the FDA issued a warning: seniors over 65 should avoid using benzodiazepines unless absolutely necessary. The American Geriatric Society has included this class of drugs on the list of medications to avoid for older adults. White heavy checkmark. Safer alternatives. For insomnia, consider cognitive behavioral therapy for insomnia, CBTI. Safe herbal remedies like melatonin or chamomile tea. For anxiety, consider lighter medications like SSRI, selective serotonin reuptake inhibitors, such as sertraline, or psychotherapy as a treatment option. 7. Anticonvulsants control seizures but cause brain fog. Common medications: phenytoin, Dilantin; carbamazepine, Tegretol; valproate, Depakote; topiramate, Topamax; gabapentin, Throntin. Brain effects on memory in older adults. These medications are used for epilepsy, nerve pain, bipolar disorder, occasionally for chronic pain. Common side effects in older adults include confusion and disorganized speech, reduced ability to process information, slower reflexes. Some people describe a sensation of brain fog, short-term memory loss, especially with topiramate and valproate. Bar chart medical warnings. Topiramate has been linked to significant cognitive impairment and is often nicknamed Dopamax for causing confusion and mental fog. Gabapentin, often used for nerve pain, may lead to memory loss and balance problems. White heavy checkmark safe usage tips. Always use the minimum effective dose. Monitor for signs of forgetting names or recent events. If these symptoms occur, consult with your doctor to reduce the dose or switch to medications with fewer side effects. 8. New generation sleeping pills, Z-drugs. Milder than benzodiazepines but still dangerous. Common medications. Zolpidem, Ambien. Desupiclone, Lunesta. Zalplan, Sonata. Brain effects on the brain in older adults. Although Z-drugs are not benzodiazepines, they still affect the GABA system, leading to short-term memory loss, especially with prolonged use. Some people may not remember activities during the night, such as opening doors, eating, or driving. High risk of falls at night due to loss of balance upon waking. Increased risk of nighttime confusion and sleep disturbances. Bar chart medical warnings. The FDA requires a warning label about the risk of engaging in uncontrolled behaviors while asleep. The Geriatrics Society recommends avoiding zolpidem in older adults whenever possible. White heavy checkmark safe alternatives. Low-dose melatonin. Establish a consistent sleep routine. Take warm baths or listen to relaxing music. Cognitive behavioral therapy for insomnia, CBTI, instead of medication. 9. Antipsychotic medications, reducing agitation but significantly worsening memory. Common medications. Haloperidol, Haldol. Risperidone, Risperdal. Quetiapine, Seroquel. Olanzapine, Zyprexa. Brain effects on the brain in older adults. Typically used for individuals with behavioral disorders, dementia with agitation, psychotic disorders. However, these medications worsen confusion in older adults, increase the risk of death in people with dementia, cause drowsiness, reduced alertness, and difficulty thinking clearly. Impact executive functions in the brain. Bar chart medical warnings. The FDA places a black box warning, the highest warning level, on these drugs, indicating they should only be used short-term and in necessary cases. White heavy checkmark safe alternatives. Implement behavioral interventions and environmental therapies. Apply gentle, consistent care methods. If medication is necessary, use the lowest possible dose for the shortest duration. 10. Beta-blocker medications, lowering blood pressure, but also lowering memory. Common medications. Propranolol, Inderal. Metoprolol, Lopressor, Toprol. Tenolol, Tenormin. Carvedilol, Kurt. Brain effects on older adults. Beta blockers are commonly used for treating high blood pressure, preventing angina and heart attacks, controlling fast heart rates. However, they can also cause fatigue and mild depression, lead to reduced concentration and memory problems. Propranolol, a beta blocker that affects the central nervous system, is particularly linked to memory decline in older adults. Bar chart clinical observations. Some studies show that long-term use of beta blockers can impact cognitive function in older adults, but the effects are milder compared to cholinergic antagonists. However, when combined with other memory-affecting medications, the cumulative risk increases. White heavy checkmark management solutions. Prioritize beta blockers that have less impact on the brain, like atenolol. Monitor signs of fatigue, forgetfulness, and difficulty concentrating. Incorporate lifestyle changes, regular exercise, a low-salt diet, and stress management to reduce medication dosage. We have explored 10 common medications that older adults often take, but which can negatively affect memory and mental clarity. While these medications can treat various health conditions, long-term use can also bring about unwanted side effects. What's important? Always consult with your doctor before starting or changing any medication. Regularly monitor your health and memory. If possible, use safer alternatives such as lifestyle changes, psychological therapies, or natural remedies. A piece of advice for you. Don't hesitate to ask your doctor for treatment options that have less impact on the brain, especially if you're dealing with symptoms related to memory or mental clarity. A wise decision today will help protect your mind and quality of life in the future. Thank you for watching this video. If you found the information useful, don't forget to like, share, and subscribe to the channel so you won't miss the upcoming videos on senior health. Wishing you always good health and mental clarity. See you in the next video.